Hello, my name is Carrie Brown, and I will be presenting on my client that I chose for the evaluation intervention process. I chose this client because I had already previously been working with her on a daily basis and would be able to continue working with her on a daily basis. For the sake of HIPAA, I will be calling her Jane Doe for the presentation. Jane Doe is a 50-year-old Caucasian woman with significant cognitive and physical health challenges. Her primary issues include intellectual disabilities, cerebral palsy, scoliosis, and epilepsy. Her last reported seizure was in 2004, and she does currently take medication for her epilepsy. She did have a gallbladder procedure within the span of the process, but this did not delay too much progress that could be made because she was only out for a few days. The main focus of this intervention was to enhance her math skills. That's the goal that she chose, which was an area that she felt was linked to her confidence and autonomy. These challenges included her anxiety around math tools, like calculators, and were identified as the key barriers to her independence in both educational and everyday tasks. The math skills were prioritized as the primary focus of the intervention because she felt that they were closely tied to her confidence and autonomy, as well as that was just something that she really wanted help with at the time. Her challenges with math impacted her willingness to engage in learning, particularly due to the cognitive limitations and anxiety around educational tools. Despite her determination to learn more math skills, she also had a high resistance to new and challenging problems. By prioritizing the math skills, the aim was to foster a greater independence in daily tasks and empower Jane to handle situations with more confidence, math situations, or really any situation. The problem at a conceptual level resolves around Jane's cognitive limitations and the anxiety that these create in math-related contexts. She perceives educational tools like calculators as intimidating, and that increases her challenges in mastering math skills. More specifically, she would quote directly her fear to be beaten for using a calculator because I guess when she was growing up, it was taught that using a calculator was bad and wrong. And she even said on one occasion that she was like worried to be beaten, and I said, well, who's going to beat you? And she told me that I would, and I said, well, I'm not going to. Operationally, this problem was measured with a multi-phased approach, tracking the progress through the Adapted Mind platform that I found, as well as monitoring the frequency of her help-seeking behavior during math tasks, and as well as assessing her confidence levels bi-weekly. The Adapted Mind platform is a teaching platform typically for kids growing up. It has grades from kindergarten or preschool to, I believe, 8th grade in like math, reading, social studies, and we chose specifically to work on the math. The chosen measurement strategy for this intervention combined quantitative and qualitative data to offer a comprehensive view of Jane's progress. The quantitative measurements, such as math mastery on Adapted Mind, were gathered weekly, while the bi-weekly confidence assessments provided the qualitative insights. Any day that she got onto the Adapted Mind and worked in any level and completed problems, whether they were right or wrong, I was sent an email from the platform saying how many problems she did, how many she got right, and what her mastery was in that grade level. The mixed method approach allowed for real-time adjustments based on Jane's cognitive and emotional responses, ensuring the intervention remained adaptive and supportive. All the data was collected during structured sessions by myself to maintain consistency, meaning the assessments where I asked questions like, how much support are you receiving? Do you need more help? How easy are the problems? How hard are the problems? What more do you want to learn? We did that bi-weekly, and we sat down and we answered those questions together, and we talked through the support she was receiving and what support she wanted more of, as well as any emotional anxiety she was having. The intervention for Jane employed two main strategies. The first was to use REBT, Rational Emotive Behavioral Therapy. The REBT aimed to address Jane's emotional responses, particularly her resistance using calculators, as well as any emotional resistance that she had in regards to more challenging math problems and anything that looked stressful and hard for her. This therapeutic approach focused on the challenging irrational beliefs, enabling Jane to view educational tools more positively. Second, the Adapted Mind platform allowed for adaptive learning, where the content was customized to Jane's cognitive level, promoting steady progress through tailored exercises. The Adapted Mind platform was made so that anytime she got a question wrong, there would be a video that would show the correct answer, and it would explain, why she was wrong, and it was a very visual, hands-on learning experience. Both interventions provided the necessary support for Jane to improve her math skills and also to reduce her anxiety with calculators and her resilience. The choice of interventions for Jane was driven by a need to address both the emotional barriers and cognitive limitations. REBT was chosen because it directly tackled her anxiety over the educational tools, and it focused on framing her negative beliefs. Empirical evidence supports that REBT's success in reducing anxiety for individuals with cognitive impairments. The Adapted Mind platform was selected for its adapted capabilities, which allow learning to progress at a pace suitable for Jane's needs. This dual approach was essential for fostering both emotional resilience and cognitive growth. Jane's weekly sessions were carefully structured to accommodate both her emotional and cognitive needs. Every session began with a brief check-in, using REBT to address any negative emotions that might interfere with her learning. This was followed by targeted math exercises on Adapted Mind. The Adapted Mind platform had multiple videos that were basically made to boost confidence in regards to working on more challenging math problems, as well as using tools for math. The intervention remained adaptable, and it adjusted based on her ongoing progress to ensure she remained motivated and engaged. The evaluation phase was comprehensive, tracking both academic and emotional progress. Jane's math skills showed a steady improvement across different grade levels, with significant gains in kindergarten and first grade content. Her confidence also grew, as indicated by the biweekly assessments, which captured her increasing comfort with math material. A key success indicator was her reduced need for assistance, reflecting a strong sense of independence and problem-solving skills. On slide, I believe, 8 of the presentation, I have some graphs of October, the last month of tracking progress that I did, and you can see her progress over time in October in regards to asking for help with Adapted Mind or the problems I was giving her. her asking for help was down to 0 and in between 0 and 2. And in August, obviously, that number was more between 5 and 10, so her need for help was reduced over this time of the intervention process, as well as her mastery level in adapted mind. She got 100% mastery in kindergarten and 85% in first grade, and then 65% in second grade. So she did get a lot done, and each of those grade levels had 250 levels within it of different problems to do. And then on slide 9, there's more graphs, and those are the graphed version of the biweekly assessments that I gave to her, with the questions asking about how much support she had and what support she was receiving and things like that. So as you can see, the first assessment, her levels were between a 5 and a 6 on how much support she had, how difficult the problems were. And then the last assessment, it shows all of the categories are between 8 and 9, which is a good increase on how much support she had. The evaluation had both strengths and limitations that provided insights into its overall effectiveness. One major strength was the use of the comprehensive mixed method approach, which allowed for a detailed understanding of Jane's progress. Adaptive learning technology also proved beneficial, offering tailored support. However, the evaluation faced limitations. Those limitations included the reliance of self-reported confidence scores, may have introduced bias, meaning that as she was looking at these scores, she might have felt like she needed to have more confidence and said she had more confidence, but maybe she wasn't feeling as confident as she was answering. And I do believe that that could be somewhat true, although there was a progress in her confidence levels. I do believe she answered a little bit more positively than she would have in any other setting. And then another limitation would have been the short duration, because a long-term evaluation intervention would have been more beneficial. So obviously there wasn't a lot of progress, and we're going to be continuing to work on this just ourselves. But there was still a decent amount of progress made within the span of the intervention. The ethical considerations were a central part of Jane's intervention because of her cognitive disabilities and limitations. To ensure that she was comfortable, informed consent was consistently confirmed throughout the sessions via the biweekly assessments and our check-ins in the morning. This process involved clear communication, framing each goal and progress incrementally to maintain Jane's motivation. Special attention was paid to avoid overwhelming her, emphasizing emotional sensitivity and supportive guidance. These steps were very crucial for fostering a positive learning environment without imposing more undue pressure, and ensuring the intervention remained ethically sound. Overall, I do believe that the intervention was successful. Again, not a whole lot of progress was made, but it was a very short span of time, and I do believe that if given more time, there would be more progress. Thank you. Bye.